You're not shocked when a nurse is coming with a surgical blade to cut you to create space for the baby to come out. You're not surprised. As she was still trying to comprehend everything, her mother from nowhere held her mouth and the nose and told her to push the baby with a very stern voice. She was in shock, horror, and confusion. An emergency C-section is like the biggest nightmare for every pregnant woman. Hi, welcome. I am Theodora, and here I talk about real life experiences, personal development, grief support, and many other things. Today I will be talking about stories of preparing for childbirth, where I talk about mental preparation for childbirth. In mental preparation for childbirth, it generally includes or involves preparing, training, and strengthening the mind of a pregnant woman to become more aware and adapted to support her physical body for childbirth. A friend of mine, a first-time mother, went for delivery with her mother. She labored for 2 days, and she said that she was in so much pain that she thought that she would actually pass out. By some luck, the midwife told her it was now time for her to deliver. She was guided and led to the labor suite, where a bed was assigned to her. She was told to lie on her back, which she did. Shortly, she started feeling dizzy, and she felt like she was passing out. She told the mother that, "Mommy, I am actually feeling dizzy. I feel like I'm losing consciousness." To her shock, she says, her mother and midwife both started yelling at her, saying, "You will kill the child. You will kill the child. You girl, and your laziness. You will kill the child," and told her to push the child. As she was still trying to comprehend everything, her mother from nowhere held her mouth and the nose and told her to push the baby with a very stern voice. She was in shock, horror, and confusion. This story may be something many may relate to, many may not, but there are certain things that you walk into the labor ward and you're totally ignorant about, and you're in shock after shock after shock. That is where mental preparation comes in. Ask around you, around your culture, what is it like to give birth? What happens in the labor suite? What happens during childbirth? And you do not get shocked or surprised. Pregnancy itself is a tough journey, but to get through delivery, you have to build yourself mentally right from pregnancy to the final lap. If you do not build yourself well during the pregnancy journey, the birth will be more difficult. That is why I share a few pointers on how you can mentally prepare. First one, make an effort to learn about childbirth. For instance, register for a childbirth class if it's available where you are, or do not miss antenatal. When you go for antenatal care, make sure you ask questions. Do not just go there, they tell you lie on your back, then they put the thing in your belly and then they listen, and then they weigh you, and then they test for HIV and other things, and then they tell you to go. That is not enough. When you go for antenatal, ask questions. Ask in-depth questions. Ask childbirth related questions. Whatever things that you have in your heart, ask them and you will get the answers. Those people have a lot of information. It only needs you to ask the questions because they are very busy and they have many patients, but when you ask, you'll be given the right answer. Research about childbirth. You can get books, you can watch videos to learn about what actually happens at childbirth or what is happening in your body throughout the pregnancy or leading towards childbirth, so that you know when certain things start happening, you are more prepared, and now you know what leads to the next phase. And this also is very important because it will highlight to you the birth processes many pregnant women undergo. That is birth through cesarean or C-section or the vaginal birth, which many people usually call the normal delivery. When you get to know each of these delivery methods, for instance, if it's a normal delivery, of vaginal birth, what happens. For instance, there you'll get to know that maybe you will need to be cut just a little bit, so that if the baby's head is big, so that when you're not shocked when a nurse is coming with a surgical blade to cut you through the birth canal, to cut it a bit to create space for the baby to come out, you're not surprised. Or you're not surprised at the time when the baby has been born and you see the midwife with a certain hook-like stuff, I don't know how it's called because I'm not a medical person, to stitch you. So you get to know what happens with the different kinds of birth processes. Many of us, I may say, when we get pregnant, we have this thing in our heads that we're going to have vaginal birth. But that's not it. There are complications that may arise and that may require an emergency C-section. So in this process, it helps you prepare. An emergency C-section is like the biggest nightmare for every pregnant woman. It is scary, it is traumatizing, but it's more challenging when you have not prepared for it. But when you get to know that there is a vaginal birth and the C-section can come maybe when you have certain medical conditions, or it can come when the child is distressed. So you prepare for any kind of birth process that may come. You're not lean to one, you just prepare that if it's a normal, if it's a vaginal birth, it's okay. If it's a cesarean, it is okay. And when you mentally prepare, it does not shock you. I know many of us will say, we shall cross the bridge when we get there. But no, it's good that you prepare and you're not surprised. The other part to mentally prepare is exercise. To exercise whereby you can physically work yourself. It's not like heavy weightlifting. For some people, if you've not been physically active, you can start by taking walks, depending on also if you're having multiple babies or you just have one child. There are various pregnancy exercises safe that you can do online that also will keep you mentally focused and not stressed out thinking about the pregnancy and whatever else that will come after. It also helps you sleep better. You could also consult with your midwife to check if it's okay for you to do exercise. Seeking counseling or therapy. We have many women who have prenatal depression and then postpartum depression. Prenatal depression is that you feel anxious, you're just stressed out, you have very severe mood swings. Of course, pregnancy brings a lot of hormonal changes, but some of this can, when you cannot be able to operate normally, then you need to seek medical attention so that can be helped. Well, if you're having thoughts of self-harm, anxiety, loss of interest in the pregnancy, I strongly suggest that you seek therapy to help you walk through this. Thank you so much for joining me today on our episode of mental preparation for childbirth.